affect sexual health. And this can be slightly different in both men and women. So in men, erectile dysfunction is commonly reported along with premature ejaculation and difficulties with ejaculation. And in women, they may experience difficulty getting aroused, painful sex, and vaginal dryness. Both genders reported dissatisfaction with sexual life, difficulty reaching an orgasm. Many reported that they stopped having sex as a result of this, and reduced or absent sexual desire. 76% of men with Parkinson's disease reported experiencing these symptoms, and 78% of women with Parkinson's disease reported experiencing these symptoms. However, only 34% of patients actually discussed these sexual issues with their partners. So common sexual problems that are associated with the motor or movement symptoms of Parkinson's disease include tremor, dyskinesias, rigidity, stiffness, the bradykinesia or slowness, difficulty moving in bed, and the masked face. So tremor and dyskinesia can cause discomfort or get in the way, especially as sometimes these movements increase with excitement. Slowness and stiffness can make sexual activity more challenging. And the masked face, where you may look like sometimes that you're not as interested. All these motor symptoms can lead to impaired intimate touch, arousal difficulties, reduced ability to orgasm, loss of erection in the middle of sexual activity, need for changes in the sexual habits and positions, and a role change where patients become sexually passive, requiring the partner to have a more active role. And all of this can lead to a decreased frequency of sex. We reviewed some motor symptoms that can affect sexual health. However, there is a long list of non-motor symptoms that can also contribute to sexual dysfunction. For example, mood disturbance, depression, anxiety, apathy can lead to a decreased desire and can also contribute to erectile dysfunction. Certain medications can even cause erectile dysfunction or reduce your libido. Reduced body image or appearance may affect your self-esteem. Fatigue can affect your desire to have sex. Concentration and memory changes, pain and sensory changes may also contribute. Sleep disturbance and daytime sleepiness, and sometimes patients experience acting out of dreams at nighttime, which may lead to bed separation, reducing the chances and opportunities for intimacy at night. Drooling and excessive sweating can also affect one's self-image, along with low blood pressure and lightheadedness and bladder dysfunction, particularly in women, and just enjoy the physical intimacy you have with or without penetration. For erectile dysfunction, which refers to difficulty, so you may have to wait longer, even 2 or 3 hours. So if you do notice this, it is important to let your doctors know. However, if you do have certain heart conditions, these medications may not be an option for you. Additional options include intracavernosal injections. This also works by increasing the blood flow to the penis. It is administered on one side. Another option is called medicated urethral system for erections, which is an intraurethral suppository. You use an application which puts a dissolvable pellet into the urethra. Alternatively, there are vacuum devices which consist of a tube placed over the penis, and it seals at the base with a lubricant. The pump helps bring blood flow into the penis to establish an erection before sexual stimulation. There is a relatively newer investigational treatment option, which is not routinely available at all practices, but can be part of a study, which is called low-intensity shockwave therapy. It is a non-invasive procedure where a healthcare provider applies a set of shocks per minute using a handheld probe. A session typically can last up to 20 minutes, and repeated treatments may be required. But keep in mind, this is still an investigational treatment option. And lastly, if the oral and injectable and the intraurethral suppositories do not work for you, there is a third option, which is an implanted penile prosthesis. It is a medical device that is implanted in the penis during an outpatient procedure, and it is entirely concealed within the body. And lastly, if psychological or interpersonal conflict is the cause of your erectile dysfunction, addressing those issues is going to be very important with either individual counseling, marital counseling, and again, management of any underlying mood disorder is silicone-based. It feels silky and lasts longer than the water-based lubricants. There are petroleum-based lubricants, however, those are medications, and when you feel like you are in your most optimal state with less fatigue and very for the patient and their partner. This can be described as preoccupation with sexual thoughts, frequent demand as you get older, and with the disease.